Hi, I'm Dr. Ramon Inso, the current president of the Philippine Society of General Surgeons Southern Tagalog Chapter, and welcome to Surviving the Cut, the first surgical podcast in the Philippines. This is a joint project of the Southern Tagalog chapters of the Philippine College of Surgeons, Philippine Society of General Surgeons, Philippine Association of Laparoscopic and Endoscopic Surgeons, and Southern Tagalog Association of Residents in Surgery. In these series, you will hear from prominent surgeons across all specialties as they share their personal stories, the trials they encountered, and the challenges that they needed to overcome to become who they are today. The main objective of this podcast is to inspire our colleagues, medical students, surgery residents, and would-be surgeons of the country as they go through the long and difficult yet fulfilling journey of becoming a surgeon. So, on to our episode.
And for today's episode, I'm your host, Dr. Gian Zafra, the current president of STARS. We are very honored to have here with us today to talk about what it means to become a surgeon. He is the current chairman of the Perpetual Help Medical Center, Department of Surgery, and the immediate past president of the Philippine College of Surgeons. He is also one of the people who inspired me to become a surgeon myself. Let us all welcome Dr. Ramon Inso. Good morning, sir.
Hi, good morning, Gian. And thank you for having me this morning.
So, this is the very first episode, and we are very much honored to have you here with us. But before we talk about what it means to become a surgeon, can you tell us briefly about the process of being a surgeon, Dr. Inso?
Oh, that's actually a long journey. And if you, from the time you graduate from high school, then you take up a 4-year course, usually or preferably science-related course. And then after the 4 years in college, then you go through 4 years in medicine proper, and after graduating from medicine proper, you go through a 1-year internship, and after doing that, you now take the board examinations or the physician's licensure examination. Upon passing the PRC initiated licensure examination, then you decide whether to immediately go into private practice as a general practitioner, or you decide to go into further training, whether it's surgery or internal medicine, OBGYN, pediatrics, among others. And it depends on the program, the training program itself. For surgery, it's now 5-year, the duration of the training is 5 years. And after going through the residency training in general surgery, then you, if you want to move ahead and go into subspecialty, then you go into at least 2 years for example, minimally invasive surgery, then or maybe 3 years in some other subspecialty, in other subspecialty. That's right. And that's how long a surgeon for one to become a surgeon. Oh.
So it's a very lengthy process, and I'm sure every step of the way there are lots of challenges from elementary up to med school, right, Dr. Inso?
That's correct. That's correct. Mm-hmm.
So if one wants to be a surgeon, you have to be prepared for the long haul. Na talagang matagal talaga siya eh. So and every step may kanya-kanyang difficulties. And then, pero po, syempre, dahil we are here in Surviving the Cut, we will focus on things about surgery. So, the Merriam-Webster Dictionary describes a surgeon as a medical specialist who practices surgery, while the Oxford Dictionary says that a surgeon is a practitioner who treats wounds, fractures, deformities, and disorders by surgical means. Pero, in your own words, sir, paano po sa tingin nyo madidescribe ng isang Dr. Inso kung paano po maging surgeon na may intindihan po ng mga medical students natin and mga residents po, pati rin mga fellow na surgeons po?
So you mean, you want me to come up with a Dr. Inso definition of the
Yes,
surgeon?
sir.
Yeah.
Yes po.
But to simplify it, to me, being a surgeon is a doctor of medicine who is trained on evaluating and treating patients, particularly those requiring a surgical intervention. And he treats them or does the intervention morally and ethically. And especially if you are exposed or you are into outreach activity, you have to treat them just like you treat all other patients. So if I should expound on the extent that the surgeon does his management for patients, it can either be you do surgery or you do not do surgery. Either way, that still defines the surgeon, because there are instances that you actually cannot tell whether at that given time, whether you have to operate or not. So, meaning, to be a good surgeon, you must know when and when not to operate. So that's basically my personal definition.
Thank you for clarifying that, kasi when you look at medical dramas that portray surgeons, and then also the mentioned definition in Webster's Dictionary and the Oxford Dictionary, it just tells that a surgeon is someone who treats wounds or fractures or does surgery. But in reality, surgeons perform holistic approach to patients. We see patients in the outpatient department, emergency room, we do rounds. We are just not confined to the operating room. So as Dr. Inso said, na nilinaw niyang mabuti na a very big part of being a surgeon is knowing who to operate and sino yung mga hindi kailangan ng surgery. So it's a balance of, will the patient benefit from a certain surgery or will he benefit more without receiving it? Tama po ba, Dr. Inso?
That's correct. And if I may add, the surgical intervention requires that the surgeon takes away the cause of the signs and symptoms, or if it cannot be taken away, at least the surgical intervention should be able to relieve the patient of his symptoms. And if not, at least it should improve the quality of life of that particular patient. So that's essentially the end goal of patients, even in the worst case scenario.
Yes, sir. Kasi nung ako po yung nung bata pa ako, sir, akala ko kasi pag surgeon, talagang nag-opera lang eh. But being where I am here now, na-realize ko na it's a very holistic approach in treating patients, not only by surgical but also medical means. So medyo mahirap talaga siyang, kailangan mo talaga ng expertise or knowledge on all aspects. Kasi usually, iniisip natin the patient is just an organ or a person na kailangang hiwaan. Pero dapat natin ma-realize na this is a person na may naramdamang symptoms, with a family, may trabaho, na the end goal is ma-alleviate yung symptoms and then maibalik yung patient dun sa normal quality of life niya. Diba, sir?
You're absolutely correct, Gian. Yeah.
So with those things being said, bakit po nag-surgery ang isang Dr. Inso? What made you pursue surgery, sir?
Yeah, to be honest, I never imagined myself when I was young. I never imagined myself becoming a surgeon. But I imagined myself when I decided to become a doctor. I decided to go for surgery for certain reasons. But what is most important is becoming a surgeon. You actually see the problem. You actually see the lesion. You actually see the cause of the problem. And no imaginations. And once you treat the patient and you decide to operate on this patient, you actually see and see for yourself also how you can liberate the patient from his sufferings and how you can, or at the very least, alleviate the signs and symptoms, or maybe prolong the life of patients. Because even as a doctor, you are duty bound to treat patients, to prolong life or improve the quality of life. So that's, I think, the important principle that any doctor for that matter should observe.
Very well said, sir. Pero kung sakasakali po na hindi kayo naging surgeon, sa tingin nyo po, ano po yung, parang may masasabi po kayong maganda, ano po sa tingin nyo ang naging iba yung line of work kung hindi po kayo naging surgeon?
Yeah, actually, I have been labeled as a jack of all trades. When I was younger, mahilig ako magkutingting ng pati mga electronics or electrical appliances. When I was very young, I was exposed to carpentry. I was exposed to masonry. I was also exposed to electrical chores. But then, nakakahiya man sabihin, I have imagined myself to become a priest. Yeah, and I will have the same laugh as you have right now. Kasi nga, during my, I should say, elementary years and maybe early high school, napakatahimik ko, and then I have always imagined there's a God, there's an angel, there are saints that I have to be aware of at all times. That's why labeled ako na para akong santo. Santo. Pero siyempre, as I was growing older, na-realize ko na I can still be a priest in principle while doing my profession by engaging myself in surgery. So that it comes with, kumbaga parang hitting two birds with one stone. So deep inside, I was like a priest, but in the actual performance of my profession, I was a surgeon guided by the Holy Spirit, guided by God Himself. I'm not saying that I'm God, but I'm just saying that I always have that the Almighty in my mind. So that is why I have always advocated saying a prayer before doing surgery, and that's built within me. Kaya ganun, nakakaya magiging pare sana ako.
Pero kung iisipin nyo rin, sir, no, there are similarities between being a surgeon and being a priest, na tayo, hindi lang tayo sa simbahan nagpa-practice ng ating profession, pero we serve the people pa rin naman and God, na iniisip natin na lahat nung ginagawa natin for the patient centered around God pa rin, di ba sir? It's very fulfilling na the following day after the operation, sasabihin po ng pasyente na, Dok, wala na po akong nararamdaman, na parang meron tayo nakikita na immediate improvement po dun sa pasyente, na parang there's something good po dun sa ginagawa natin.
Yeah, exactly. And that is why being doctors, we are most of the time outcome-based, and particularly in the field of surgery, we are so, the feeling of that particular fulfillment is very evident, especially when you are able to remove the tumor that the patient has been bothered about for a long period of time, or perhaps at the very least you take out the apprehension of the patient who has that big tumor, and just the mere show of smile on these patients will already have a very fulfilling effect on our part as doctors or as surgeons in particular.
Kaya sir, parang yun yung maganda ngayon sir, na medyo na-uplift na yung protocols regarding lockdown, na pwede tayong mag-alis lang saglit ng mask natin para makita ng pasyente yung mukha natin na nakangiti, para just, kasi lalo na sir, di ba, pag kung pasyente ka na operahan before ka matulog, syempre nakikita tayo and the anesthesiologist, parang there's a sense of security na nakita mo yung anong itsura nung surgeon mo tsaka nung doctors na mag-handle sa'yo, na nakangiti sila, na parang panatag yung loob mo dun sa pinaubaya mo yung sarili mo sa kanila during the surgery, di ba sir?
Yeah, that's since you mentioned the effect of that pandemic, nakamask tayo lahat, and actually
gumaling tayong umiti sa mata.
ngiti-ngiti na lang tayo, pero it's really important na part ng communication natin with the patient, establishing rapport, that we show our face. And minsan na label nga tayo, kaya nagtatakip yung surgeon ng mask kasi pero siyempre that is in the context of a joke.
Opo.
But that is part of our protocol. But then you are correct when you say that it is important that we show our face, in as much as we want to look at the faces of our patients and look at their facial expression, and parang natuwa ba sila sa kasi pag nag-smile na at these patients, whether they are private or not for charity, the mere show of their smile of satisfaction is already a very fulfilling experience. Tama.
Masaya sir, na nakikita mo silang humingiti from before na namimiligpit sa sakit, tapos biglang mag-i-improve sila na tumatawa na nakikipagbiroan na sir. Right. Sa tingin ko yung isa sa mga pros ng pagiging isang surgeon. So, sobrang toxic sir ng life ng pagiging isang surgeon. So, lagi tayong on call, tapos me as a resident 5 years. So, medyo matagal din yun. Tapos, even after residency, we are bound to a lifestyle na pwede tayong ipatawag anytime. Ikaw sir, meron kang 3 anak, happily married. Paano nyo po siya na babalance or na balance sir during residency, and ngayon pong na full-fledged na accomplished surgeon po kayo ngayon?
It takes a lot of coordination with your family, actually. And I'm very blessed that my wife is medically oriented. She used to be a medical technologist, and she fully understands the demands of being a surgeon. And I'm triply blessed also that my children followed the lifestyle that I took. and the eldest is also a surgeon. The second one is an anesthesiologist, and the third one is another surgeon, a vascular surgeon. And we all understand the demands of the profession. Yeah, I don't have any problem balancing family life with the practice of my profession. So I did not have any problem, and thanks to them, and thanks to my wife, and my wife saw to it that during the younger years of our children, they were fully taken care of, cared of by her, and I can now see the fruits of her labor, and they have become full-fledged surgeons and anesthesiologists. So no problem with that.
Tas dadagdag ko rin, may I add sir na aside from being a family man literally, being part of the training program for general surgeons po ng Perpetual for the longest time, parang kami po mga naging residents nyo, parang anak nyo na rin na sobrang dami kasi nakikiagaw rin kami sa time nyo with your patients, with your family na kailangan mo pong i-balance kasi maliban dun sa time is yung part din po mismo ng pagtitraining kasi hindi lang basta time po yung kailangan, di ba? Yung pati rin yung quality po ng ibibigay nyo sa amin na training. So, paano yun sir na may ganun pang aspect pa ng life nyo as an educator din?
You know, Gian, I'm glad that you mentioned that, and I take that as a compliment that you acknowledge the effort of the trainers like me. And that's the other part of being a surgeon actually. You feel responsible for the future surgeons because for all I know, any one of you might be the ones to operate on me should I need your services, should I need a surgical intervention. So that is why it comes automatically on the practitioners, particularly in surgery, especially if I am practicing in an institution with an accredited training program in general surgery. I take it upon myself, and that's quite automatic already, that we feel responsible for all the trainees. And having said that, you have become part of my family.
Yes sir.
And
Ramdam naman po.
I am very happy when you pass the boards and then you have a successful practice and you follow the same values that we advocate. Kaya very happy ako doon na the trainees are actually part of my own family.
So sinabi niyo sir na happy kayo doon tapos kasi i-share din po natin to sa Spotify na hindi kita yung video pero sa mga nakikita yung video feed namin ngayon na masaya si Dr. Inso. So para talagang we will be led to believe na all sunshine lang yung pinagdaanan ni sir. Meron po bang time na naisip nyo na sobrang hirap pala nitong ginagawa ko na parang hindi ko na to kaya, ayaw ko na nito, sir?
Yeah, I would be lying if I will deny that. But maybe during the early stage of my training, I did have that kind of feeling that at certain point where I am in so much stress as far as patient management is concerned and trying to balance the demands versus the expected outcome, the surgical management of patients. That's quite stressful actually, and there came a time that some of my friends or some of my classmates in high school and in college who have shared their experience as a manager of the band, as an executive already, and earning this much. I asked myself, am I into the right profession? But then, in a matter of hours, or shall I say days, I realized that it's still really worth it. And no amount of money, no amount of remuneration will replace the happiness that you experience once you treat patients, especially those really needing, I mean, especially those who are in need but could not subject themselves. And I mean the underprivileged patients. And the outcome is very good, and then they give back their smiles and their thank yous. The happiness is extreme, and I suppose it cannot be replaced by any other profession. And I realized I just have to move on and continue what I'm doing, and since I'm happy with it, then I'll just continue doing the things that I do. So, mahirap din na iisipin mo, ayaw ko na. Kasi in that manner, maaring in the first place, either hindi ka na happy o hindi ka na determined to go on with your chosen profession. Kaya I've heard of some instances where some doctors would actually venture into different kinds of specialty, or they totally quit and shift themselves engage themselves in other fields, or even profession. Magnegosyo na lang. So I'm just very happy that in the first place I was so determined, but certainly I cannot deny there are challenges. But then I pursued and persisted, and then it totally paid off din naman. And I'm happy.
Sa tingin ko, sir, not just in medicine, in surgery, I think people should just be able to find what it is they really want first, no, sir? So, ano po may ibigay niyong advice for struggling, kahit hindi struggling siguro, for med students, surgery residents, or even those in other residency training programs na niisip nila siguro hindi to para sa akin, na ano mabibigay niyong advice sa kanila, sir?
Yeah, maybe i-fast forward ko na lang, kasi parang if you are decided already to become a doctor, then go for it. So fast forward in the sense that after becoming a doctor, and you are trying to figure out which specialty you wanted to go into, very simple lang. Find your happiness. Ganun lang. Find your happiness. And if you are happy with that specialty, then tuloy-tuloy lang. Don't look back anymore. If you look back and then you find another opportunity, ay, iba istorya na yan. Kaya, fix your mind and go for it. And then, that's it. And accept that there will always be challenges. Kahit ano naman, di ba? Marami naman challenges. Kahit anong profession, kahit anong specialty, whatever. There will always be challenges. Kaya, find your happiness.
Tsaka sa tingin ko, sir, basta ginagawa mo yung sa tingin mong tama, tsaka yung makakatulong, lalo na yung part na makakatulong sa iba, sa tingin ko, sir, malaking part yun ng pwedeng maging mag-play ng part sa happiness eh. Then happiness will come along the way na rin. So, ganun. So, sa ngayon, sir, ano po yung masasabi nyo naman sa mga aspiring maging specific tayo, sir? Kasi you've become a man of your stature, sir. Naging president po kayo ng Philippine College of Surgeons. Ano po yung maibigay nyong advice sa mga current na residents po natin in surgery?
Yeah. So, having decided to become a surgeon, and you decided to train, that's already a sign that, a manifestation that you really want to become a surgeon. Then work hard, work hard and strive for excellence. Work hard in order to be able to treat your patients well. And I would like to emphasize that. Treat your patients well. It's not easy to be a patient. Imagine yourself if you are a surgical patient, if your relatives are surgical patients. As a resident, alam mo kung ano yung what it takes to manage these cases. Kaya you should try to place yourself in the shoes of these patients. And I'm talking about being compassionate in all aspects, and of course without sacrificing the quality of the surgical procedure that you are going to do. Always bear in mind that you have to address all other concerns. And what I mean are the following. One, is the surgery necessary? And if it is necessary, then what kind of procedure should you do? And third is, will it not be too burdensome on the patient, either physically, emotionally, or even financially? So you have to think of those aspects. And once you have addressed all of those in a compassionate way, then we are almost sure that you will end up with a very happy patient. And that will totally help in the recovery of patients. So, yun. And basta tuloy-tuloy lang while in training, strive for excellence, and then master the craft. So just to cite an example, during my training, pwede nating sabihin na literal na nakahiga ako sa libro. Nakahiga ako sa libro. My head is pressed against that book. But figuratively naman yon. Pero literally, basa ako ng basa. Pag merong case na ganyan, paulit-ulit binabasa. And then you go beyond that, refer to some journals, new developments, what's new, what's the update on those situations or conditions. And then that particular habit will become automatic, and that will help you out as you engage in surgical practice. Okay, and of course, one of the important things that you need to do also is, because you are reviewing, you're striving for excellence, and the chances of you becoming a full-fledged surgeon, being a diplomate, you pass the certifying examinations, and then you become a member of the organization of surgeons, then that will really help a lot, especially when you go into practice. And any time that you have problems with the treatment of your patients, then you can call a friend, call your colleagues, refer, things like that. And of course, you should know your limitations. Okay, that's it.
So dami na nating napag-usapan, sir, no? Kung paano maging surgeon, ano yung mga pinagdaanan ninyo. And it's a lot, kahit na sobrang iksi pa lang po ng conversation natin. Yung last na question ko lang po para sa inyo, na sa tingin ko pong gusto ring marinig po ng audiences natin is, worth it po ba na naging surgeon po kayo?
Very much worth it. As I have emphasized, I have learned a lot. I have worked hard for my profession, and then patients come to me either for consult, for the surgical procedure, or any help for that matter. As much as I can, I have helped a lot, and I extended that with doing regularly surgical missions, and the beneficiaries of which are those who are underprivileged, and they are in the underserved areas where there are no doctors.
Yes, yun pala yung we forgot to mention. Dr. Inso is also a proponent of a group that we call SURE, that is Surgery for the Underserved and Education. So, what we do in this group is we go to places, far-flung areas, where people can't have access to good medical and surgical care. So, yun yung ginagawa. So, Dr. Inso is one of the proponents of that program.
Yeah, i-inject ko na lang din kasi sa Philippine College of Surgeons, we created the 3 commissions. The first is the Cancer Commission, the first is the PCS Cancer Commission, the second is the PCS Trauma Commission, and the third is the SURE Commission, the PCS SURE Commission. SURE, S-U-R-E, stands for Surgery in the Underserved Regions and for Education, where we do the necessary surgical procedures and at the same time educate either the doctors in the area or the healthcare providers in the area, or even educate the community itself. So that's part and parcel of the objectives of the PCS SURE Commission. So that's what we usually do.
So, thank you again, Dr. Inso. That ends our first episode of Surviving the Cut. Thank you very much, Dr. Inso.
Thank you for this opportunity, Gian.
For our next episode, we'll have another distinguished surgeon with us. If you have any questions and suggestions, leave them in the comment section below. Again, this is Surviving the Cut, where we will tell the stories, trials, and challenges in surgery. I'm your host for today, Dr. Gian Zafra, and our first guest, Dr. Ramon Inso. Thank you.
Thank you.